told that changing a child's name, pronouns, and identity is an act of love. But what if that so called affirmation is actually the start of a dangerous medical experiment? Pediatrician Dr. Michelle Cretella says social transition isn't harmless. It can confuse children when they are not being told the truth about their identity as male or female, disrupt their normal development, and lead them down the path of chemical and surgical interventions. Today on Bioethics Babe, we're identifying the risks of social transition on children and asking the hard questions no one else will. Are we trading science for ideology and having children pay the price? Tune in for a thought-provoking discussion on the effects of social transition on children. Welcome to the Bioethics Babe podcast, where we examine the tough questions in human flourishing in light of science, faith, and culture. I'm your host, Darina Grosso-Agnew. Now let's dive in. Today on the Bioethics Babe podcast, we're joined by Dr. Michelle Cretella, a pediatrician, researcher, educator, and nationally recognized voice on child and adolescent health. Dr. Cretella is the former executive director and current chair of the Adolescent Sexuality Committee at the American College of Pediatricians. She also serves as a pediatric spokesperson and educator for the Association of American Physicians and Surgeons and the Catholic Medical Association, and consults for the Rhode Island Family Institute. She sits on the boards of Advocates Protecting Children and the John Paul II Academy for Human Life and the Family, and is a member of the medical division of the Alliance for Therapeutic Choice. Dr. Cretella also lends her expertise as a peer reviewer for several medical journals, including the Journal of American Physicians and Surgeons, Issues in Law and Medicine, and the International Journal of Behavioral and Healthcare Research. Dr. Cretella earned her medical degree from the University of Connecticut School of Medicine, completed her pediatric residency at Connecticut Children's Medical Center, and later a fellowship in college health at the University of Virginia. She practiced pediatrics with a special focus on behavioral health for over a decade before taking over as executive director for the American College of Pediatricians in 2012 and to dedicate more time to her family. She and her husband are proud parents of 4 grown children. Today, Dr. Cretella joins us to talk about the hidden risks of social transition in children, why she believes this growing trend deserves urgent ethical, medical, and parental scrutiny. Welcome to the show, Dr. Cretella.
Thank you so much, Arena. It's great to be here.
Well, we want to start off by first understanding what pulled you into pediatrics during your medical training at UConn.
Well, you know what? To be honest, I had a lifelong love of both children and science. You know, from the time I was 11 and started babysitting, being camp counselor at various camps, eventually nannying, tutoring, I absolutely had a love for teaching and nurturing children. So when I did get to medical school, it just sort of seemed like a very natural fit. I had a little bit of a hard time deciding between family practice medicine and pediatrics until I realized what I really loved is the fact that children are so resilient, and I'm a simple person. Children tend to get one medical problem at a time versus when you get more to my age and the older side, when you have multiple things going on at once. So I was just, as I said, that natural love for children for a lifetime, combined with their resilience and just being able to focus my energy on 1 or 2 problems at a time that I knew I could really get them through.
Right. And of course, obviously your love for children is the reason that you're doing this work. So when you were the past executive director of the American College of Pediatricians, when did you see the ideology surrounding sexual identity disorder start creeping into mainstream medicine?
Well, surprisingly, it was brought to my attention by a colleague at the American Association of Pro-Life OBGYNs, Dr. Mary Davenport, who lives in the Berkeley area of California, sent me an email one day, early 2011. She said, "Michelle, there is a lesbian couple, and they are going to transition their son, who's only 8 years old,
Hmm.
They're going to transition him socially and soon after with puberty blockers. What are you going to do about this?
Wow.
And that it was not on my radar, but fortunately, this friend of mine, by virtue of where she lived, so I immediately researched that particular case and was shocked to find, because I knew nothing of puberty blockers with the exception of precocious puberty. Um, and in adults, I knew it was used to treat prostate cancer in men, but other than that, this was new to me. Um, and once I thoroughly researched it, I realized, oh my gosh, we're potentially, because not only was it puberty blockers, they were speaking of also then introducing down the line, introducing the cross-sex hormones, and that meant sterilization. And I don't recall the number of states back in 2011, but there were several that at that time were still using Lupron, the most commonly prescribed puberty blocker. We're using Lupron to chemically castrate sex offenders. So this was just shocking to me that any physician would be greenlighting this for a psychological um, disorder, because in 2011 it was still correctly identified as um, well, it was called gender identity disorder. And truth be told, sex or sexual identity disorders is a better term, because these are individuals who are psychologically divorced from their physical bodies. Mm.
Right, and it's terrible to think that for an 8-year-old, his brain isn't developed enough for those decisions, and these adults in his life are making decisions that will affect his fertility, everything, and, it's such a huge issue, and obviously, it's since 2011, it's, ballooned so much, so
Absolutely.
this is why we're going to do a series on this issue because it is a problem. But although, as you've seen, it looks like it's actually pulling back, right? Decreasing on college campuses,
There's
etc.
we don't know for a fact that the identification is decreasing. We do know for a fact that the awareness of the harms of this ideology, the awareness that it's ideology and not science, the awareness that no good, truly compassionate physician or family member would ever put their child through this, that awareness is growing. Thank God. That's huge. We only have it was one compilation of stats that were released on X maybe 1 or 2 weeks ago by a Dr. Kaufman in the UK. What he actually reflected or assessed was rates of college students identifying as non-binary. He did not look at other transgender identities. So looking at that narrow, just that one identification, he drew the conclusion that it's in a free fall. Many of us are not convinced. We would be willing to say, yeah, we would expect with further, perhaps more representative investigation, perhaps we'll find some downward trend, but we really, based on his one presentation of limited data, we're hesitant to make that conclusion.
So, Dr. Cretella, in 2016, you published an article, "Gender Dysphoria in Children and Suppression of Debate," in the Journal of American Physicians and Surgeons. What pushed you to speak out at that moment, and how did the medical community react to that?
Essentially, it was both my medical colleagues and the general public. I was receiving numerous phone calls from, first of all, from absolutely distraught parents, most of them going through divorce and in custody battle with and it was almost 100% of the time, a teenage daughter who, during the divorce proceedings, decided out of the blue that she was really a boy trapped in a girl's body. And one of the parents would align with the gender ideologue physicians and want to put the daughter on the blockers and cross sex hormones. And the other parent, of course, was utterly distraught, just could not ignore, common sense and sanity. So I had parents reaching out to me being told the medical system is against us. There's no one who can help us. Can you help us? And at the same time, I was receiving emails and phone calls from surgeons, psychiatrists, not endocrinologists, really physicians from across the board, as well as medical students saying, is there anything you can do? Because I can't speak out. I believe that sex is a biological reality, but if I speak out, I'm going to get fired. At that time, it was absolutely career ending to stand up for Biology 101. They tended to be second-year medical students. They were getting heavily indoctrinated in their classes, and they would individually write and say, when did Biology 101 change? I can't even question, let alone stand up for the fact that there are sex determining genes at fertilization. I'll be sent for remediation. I'll be held back. So I had to do something. I had to act. Some physician had to get the fact of censorship of basic scientific truth out into the open. And the Journal of the American Physicians and Surgeons is peer reviewed. Once it was released, it's also available online, and the general public, it's open access to the general public. So from there, the Daily Signal picked it up. They started interviewing me and featured me in some public service announcements, which then led to getting discovered by Tucker Carlson. And he had me on his program, and I guess I don't know if he actually read any of my articles or public service announcements, because when he interviewed me and I stated quite matter of factly, puberty blockers and cross-sex hormones will sterilize children, he was stunned. And a little aside, my parents who were watching called me up after, and my mother said, he's never quiet. He listened to you. He didn't interrupt you once.
Well, it's a message that we still need to hear to
Yeah,
this day,
yeah,
right?
yeah,
Not
but,
enough people know that, right?
right.
It's not a matter of opinion. It's actually
No.
what happens medically.
Yeah, yeah. Just prior to being interviewed by Tucker Carlson, even members of and this got me very excited, because prior to the transgender issue, the American College of Pediatricians was most well known for our pro-life stand, defending our unborn or preborn, defending the preborn babies. And I was shocked also in 2016 to be approached by several radical feminists, and generally either left of center or leftist therapists, who also saw the harm. They could not get past the fact that medicine was now okay with sterilizing children. So they all believed in abortion, and they were all LGBT adult T affirming, but that was a step too far. They were not going to sanction the sterilization of children. And so they reached out to me, and the first one, her first name was Marie, and I'll never forget this, because she called and she said, "Good morning. I just want to let you know we are really far apart on most issues. And so before I go on, I just want to clarify something. I agree with you that this transgender movement is sterilizing children. I just want to make sure you're not okay sterilizing LGBT kids, right?" And I said, "No, we don't want to sterilize any children." Now, I mean, but what was amazing, and this is so important, I think, for your audience to hear. So these radical feminists who are gender critical, gender ideology critical, joined together with several conservative women, I would say mostly conservative Christian women, and formed the Hands Across the Aisle Coalition on Facebook. And so over the course of several years in working together, I was amazed to learn that true radical feminists, like conservatives and Christians, are opposed to the sexualization of children. They oppose pornography. They oppose legal prostitution. So we actually share more common ground than I ever realized. just unfortunate that they accept the killing of innocent preborn children as necessary to protecting women's rights. But nevertheless,
I think this is a really good point that this is an issue that cuts across the aisle, and
yeah,
this show is nonpartisan. And I think that where we have common ground, we really need to, as you mentioned, join hands across the aisle because it's
yeah,
important to defeat this evil that's happening to children,
hmm,
where adults are making decisions on behalf of children, or children who are obviously not mature enough to make those decisions are making those decisions that will affect them for life. Wherever we have common ground, I'm always a proponent of doing those things together because it makes us
absolutely.
stronger, right? And especially when detransitioners share their story, and they were on one part, and then they decided, "This isn't actually what I thought it was going to
Right.
be," and changed my mind about it, and so that there's room to have a community that's very diverse,
Yes.
who's all standing up for protecting children and their dignity. So you pivoted from, hands-on pediatrics to full-time advocacy. Is there a particular moment where you said, "I can't stay silent anymore"?
I think I've always had a big mouth on standing up for children. So my decision actually to pivot to full-time advocacy had more to do with my own 4 children at home. We had 4 kids and 7 or I had the 4 children, in 7 years. And so by that time, they were, I our 2 oldest were certainly in middle school, and I knew for the health my own health and the health of the family, I needed to shift my work to be at home, to work from home. And although I definitely missed the hands-on, being with other families in the office, I would have been a hypocrite were I to stay in clinical pediatrics even just 2 days a stay there even just 2 days a week and be sacrificing my own health and the health of the health of my children. So I did not regret it at all, and it allowed me to keep up my, continuing medical education credits, my use the education that I worked so hard for so many years. So it was a perfect balance.
And of course, to continue your advocacy in a different way.
Right, absolutely.
So I want to transition now, speaking of transition, into discussing all about social transition because, as we discussed with Dr. Jill Simons in another episode, that social transition is the conveyor belt for the rest
Mm,
of those types of interventions that kids would end up going through. But it starts with social transition. And think that a lot of people think that social transition is harmless. Well, just because we call you a different name or you wear clothes that are of the opposite sex, those things obviously can be reversed. But there's a lot that it leads to which can't be reversed. But before we even get into those topics, let's just define the terms. So, what exactly does social transition mean for a child with sexual identity disorder?
so social transition is essentially role playing. It means, as you alluded to, new name, using the wrong pronouns, or it could be opposite sex pronouns or made up pronouns, not only in the home, but also imposing that on the entire community, the rest of the family, social circle, um, as well as dressing the children, uh, either cross dressing or gender neutral clothing. So it's appearances. It is role playing, but not merely just within the home, but also imposing that role playing, and quite frankly, a lie, um, on others.
And does this usually start in the clinic? Does it start at home? Does it start at school? Where do you see that a child is it that the child gets the idea, uh, I want this, or is it a parent who imposes it on the child? obviously it's case by case. But what have you seen in this discussion and in this, just in terms of your experience of this in the way it's played out?
Sure. So I'm not aware of statistics, but in my role with the American College of Pediatricians, over all those years, it's predominantly been one of two things: either imposed on the family, I'll say imposed on the parents by schools or courts. And even in those cases, it typically started with the child becoming ensnared in online transgender chat rooms. So I think the largest factor from my experience and also my discussion with my colleagues in psychology, psychiatry, and other fields of medicine, social media, the impact and ideology coming from social media cannot be overstated. It's huge. There's definitely, though, and I don't know what the percentage would be. There's definitely also a certain amount being imposed on the child from families. You might remember the fad, and I can't recall exactly what year it came out. We're having a baby. The baby, and it's still around, where parents decide they think we're going to be super enlightened and progressive, and we are not telling any family members or friends the sex of our baby before or after birth, and we're giving our child a gender neutral name and dressing their um, child maybe just in pastel yellows or greens. So we want our child to decide what they want to be called, whether, what pronouns to use. Yeah, that would be, I think, the most pernicious um, situation, the most abusive and developmentally threatening situation for a child to be in.
I think this gets back to the question of nature versus nurture, and in terms of, are we just affected by our environment, or is there a biological reality there, right? And so I think that we've seen in experiments, and we'll get into John Money in a different episode
Mm,
more more explicitly, but that in experiments where you try to erase the biological reality, the children who are and the people who think that children are just a blank slate and that you can just influence them, end up becoming quite messed up, because obviously there is a biological mark on us that makes us who we are. And it's not just nurture, it's not just whatever is in our environment. Have you seen that? And what, in terms of the medical literature, especially on this issue, because obviously there were a lot of different experiments done on nature versus nurture. What's your take on all of that?
so two sort of two separate issues. No child is born knowing they are male or female, a boy or girl. No one is born knowing that. Every child is born either male or female. And for those who would raise their hands and say, that's a lie, what about intersex conditions? Let me just say, individuals with disorders of sex development are male or female human beings who have malformations or deficiencies of their reproductive system. And I'm sure you'll have an entire episode just about that. And if you need a guest, I have a phenomenal one for you to recommend. Let me just explain how a child comes to recognize the reality of their physical bodies and the reality of their sex. It goes back in psychology to Jean Piaget, who outlined the stages of cognitive development. And in terms of a child developing the knowledge about his or her own sex, it happens between the ages of birth and 7. Um, and it was the psychologist Dr. Lawrence Kohlberg who studied Piaget's cognitive framework, I believe also in the late 60s, early 70s, and found that most children by age 3 can correctly identify whether they are a boy or a girl. It's not until age 5 that most children recognize that girls grow into women and boys grow into men. It's not until age 7 that cognitively, in terms of that brain development, children are able to understand that sex is a permanent physical trait that belongs to me, even if my appearance is different. So even if a man puts on lipstick and a dress, he's still a man. That is not fully comprehended until age 7, maybe 8. So this is the normal cognitive psychological development of a child. So and this isn't just about, the truth about sex, right? I mean, every mother and every parent and grandparent knows, okay, children aren't blank slates, but they're not born with a set of knowledge about the world. They have to learn from us. And that's why we don't lie to children. I'll ask people, look, what is one of the first realities an infant becomes aware of? And they would say, oh, well, their mother, even prenatally, preborn children, they hear their mother's voice. They know her daily schedule, um, secondarily, they can hear if dad is in the home and involved. They will recognize dad's voice even prenatally. But in those first few years, their bodies, their physical bodies. Okay. Yes, their parents first, but then also their physical bodies. And if a child cannot trust, number one, his parents not to lie to them, him or her, and if they can't trust the reality of their own physical body, who or what can they trust? And if we lie to them about that basic fact of their identity, we are physical bodies, we're minds as well. And those of faith would say, body, mind, spirit, fine. But if a child cannot trust his or her own physical body, then what can he or she trust? So to lie to them about the meaning of their physical body is destroying their capacity for reality testing at the root. That is why social transition, which is lying to children and having them role play a lie, that is psychological abuse.
Wow, that's so powerful. And
Mm,
of course, this is exactly what's happening, right? And
right,
it's happening not just at a micro level,
right.
the fact that towns have library hours with
Yes,
people who are cross-dressing, then a little child going to a library hour sees a man dressed like a woman with lipstick on and says, "Oh, well, is it possible then for a male to be a female?" And so it's I want people to understand that this is happening not just in individual homes, that towns and states are supporting this. So there's a system already in place, and obviously there are bills and laws that are fighting this, because obviously it's not true to reality, but it's an institutional problem, is
thank you.
what I'm getting at.
Absolutely.
And it's an institutional abuse, right?
Absolutely. It's an institutional abuse. The biggest harm from an ideology is that it is dangerous ideas and language, right? Language, false language, lies and false language uh, are harmful, especially if we're lying to children. It's amazing to me that some people can be so upset and against the idea of Santa Claus and yet see no problem with lying to a child about their body. No, just as an aside, I am Uh, I could go either way on Santa Claus, but but at least with Santa Claus, that is a lie with an end in sight, and it just simply does not compare to lying to a child about the reality of their physical identity. Um, yeah, one is outright abuse, and the other, maybe some children find it too heartbreaking and would have preferred it not. But my point
One
is,
is a fairy tale in a
one is a
sense.
fairy tale. That's right. One is a fairy tale, about generosity and kindness. And this lie, which is being, well, not under the current administration, but federally, the current administration, thankfully, is walking back the errors of past administrations. But we have an entire generation of children and young adults who have been indoctrinated into believing that their bodies are irrelevant to their identity. And this is very damning.
You said something very interesting about intersex cases. Do you have an idea of how many cases there are? What percent? And also, when you said that it's a developmental issue of with their organs, but of course their cells are sexed, right? Every cell is sexed. It's either male or female. So even in the intersex cases, you can still tell if a person is male or female at a biological level.
So, what we're going to do is we'll stop using the term intersex, because intersex means literally in between.
Mhm.
And that is medically inaccurate. And so, this is why the medical community has moved to the more accurate term disorders of sex development. They are essentially genetic disorders impacting the reproductive system and sometimes other systems as well. There are two broad categories. One category of disorders of sex development includes ambiguity at birth, meaning by sight, we have ambiguous genitalia. We can't tell, looking at the infant, if this is a boy or a girl. Those cases occur in about 2 out of 10,000 births. These infants will undergo a host of genetic testing, blood tests, hormones, etc., to identify basically what uh, what is the medical condition. What is the medical condition, and also imaging. Uh, is this child Was the child on the male path or the female path? And how can this child function going forward? In the past, there was a rush to, oh my goodness, we had fewer tests available. And there was this rush to determine, is this baby male or female? And corrective surgeries may have been done too soon. I know you will read or hear about these in various chat groups. Now, a slower approach, a more thorough approach is being taken. The other group of disorders of sex development, actually, there's no question when they are born. They are, we say, phenotypic. Their bodies declare whether they're male or female. Down the line, they may have difficulty getting pregnant or I should say conceiving, whether they're male or female. They may be trying to conceive, have difficulty with conceiving. And some men may, on workup for infertility, discover that their genetics are XXY. Well, they are true men. They have a Y chromosome. However, there is a genetic, well, they have two X chromosomes in addition to the Y. So they are male, but because of the extra X chromosome, they have low sperm count, for example, and so conception is more difficult. Similarly, some females may learn that some of their cells are XX, others may be XO. They are mosaic for Turner syndrome and therefore have decreased fertility. So this is just it is a complex topic, but the bottom line is when it comes to the transgender issue, this is a matter of the mind. There is no medical test to identify someone who calls themselves transgender versus someone who is not divorced from their body. Disorders of sex development are physical medical disorders. And yes, it can be heartbreaking and a obviously difficult process to go through, just as with any other medical disorder. And today, with a team approach, we are now able to correctly identify and assist people with disorders of sex development to live happy, fulfilling lives.
Right. But the majority of cases of where people identify as transgender, we're not talking about these cases,
Oh,
right?
no, not at all. Not at all. Two entirely separate issues. The, the activists, the gender ideologues, are exploiting. They are exploiting individuals with medical conditions. They're exploiting these individuals with disorders of sex development by speaking a lie about them, saying that these individuals, they're not male or female. There are 5 different sexes. They're on the spectrum. Sex is defined according to the role an organism fulfills during the reproductive act. So and that's whether you're a plant or an animal, human being or one of the animals. So if the organism is donating genetic material during the reproductive act, whether plant or animal, that is termed male. If the organism is structured to receive genetic information during the reproductive act, that organism is female. So there are only 2 sexes, and 2 live births out of 10,000 deliveries, you will have an individual with a disorder of sex development that the sex is ambiguous without further medical investigation.
Thank you for clarifying that. I want to go back to a point you made about children, mostly in their teen years, who then going online, they go into chat groups. They're influenced by what's happening on social media. At what age do you see this happening mostly, and where either young teens or even younger than that are being influenced by social media and culture? Is it social media? Is it games? What is it that is affecting them, you think? And what is the youngest you've seen a child actually say, think I'm being confused about his or her own sexual identity?
Me personally, the youngest, and again, this was back in 2010, before the transgender ideology took off. But the youngest case I personally had was a little boy who um, the parents were concerned at his 5-year-old physical, because he at that point was saying he was a girl, and he started expressing cross-sex play and maybe some cross-sex dressing at age 3, at which point his sister with special needs was born. So ultimately, uh, that little boy, when I referred the family to therapy and it became evident in play therapy over several months that he had internalized this false belief that his parents only loved girls. He had been this only child for 3 years, king of the hill, and then little Sissy is born, and she had profound special needs, and this rocked his world. Now, not every, our psychology can be very individual. Not every 3-year-old boy in that situation would internalize this misperception that mom and dad only love girls, and then express the desire to, oh, yeah, I'm a girl. But for, we call him little Andy, that was his situation. But once it was identified, now the therapist could work with the family, the parents and the little boy separately and together. And he was able to come, I think over uh, the course of a couple years, he was back to embracing himself as a boy and recognized better what was going on. In terms of the culture, and even I'm thinking back now to doctors Ken Zucker and Susan Bradley, who really spearheaded the treatment of gender identity disorder in children in the 1980s in Toronto, Canada. They had a clinic. At that time, it was predominantly young boys, and I would say it was probably preschool age that this might naturally occur some. And so it, when that confusion about am I a boy or a girl, they would step back and analyze the situation. Is this simply a phase? Because remember, with cognitive development, age 3 is when you're first figuring out correctly, I'm a boy or I'm a girl. And then a child doesn't truly understand the stability and constancy of sex until age 7. Or they would also have to consider, is there something going on in the family during the 1980s? We didn't have social media. With social media, I would say, and the internet, children certainly by middle school can get sucked in. um I would say social media, video gaming, gay straight alliance clubs in school. And I would say the predisposing factor, um a child who has some sort of trauma or sensitive disposition, maybe they're on the autism spectrum or ADHD. Those children are going to be more prone to anxiety, depression, more vulnerable to the love bombing that goes on online, more vulnerable to the lies, more vulnerable to the love bombing and the gay straight alliance clubs. And similarly, in your teen years, we do know from the psychiatric and medical literature that the vast majority of teens who become convinced of transgender ideology, they have on average 5 traumas in their childhood. They have several serious medical illnesses that may or may not even be actively treated at the time, including, everything from anorexia to depression, anxiety. So when you have those underlying issues that are going unaddressed, and heck, I mean, I make audiences laugh when I'll if I'm even when I'm speaking to doctors at medical education conferences. I'll say, "Hey, how many of you in the audience think that your adolescence was just like the prime of your life? You would just love to go back through puberty." I mean, puberty it's a critical stage of development. Man, it is not fun, right? So even children without severe traumas or vulnerabilities can be sucked in by the love bombing because everyone wants to belong at that stage. And we know from Dr. Eric Erickson, social science psychology, that the teenager's one job is to figure out who they are, to really separate from their parents and figure out their identity. So if they go online, they're in the GSA clubs, they're getting all this indoctrination from the classroom and the movies and whatnot. They're just going to say, these people are saying, I'm unhappy because I was trapped in the wrong body. All I have to do is this. They want the quick fix. They don't have, they don't have the physical life experience that adults have. And they also don't have the judgment centers of the brain fully mature until 25 years old.
Mhm.
So there's a lot there.
Right. And how many of these teenagers who may think that end up desisting? What
Right.
percent?
Again, we we do not have good studies on desistance rates. Um, the pro transgender ideology side will frequently say that, oh, regret is only 1 to 2%. So desistance can't be any greater than that. Uh, but when you actually pull those studies, which claim, uh, only 1 to 2% regret, they have a loss to follow up of 30 to 60%. So, and the authors of those studies amazingly have no curiosity. Gee, why can't we get in touch with these people, these 30 to 60% of people who went through hormones and surgeries? Why don't they want to respond to our survey? Hmm. Are they dissatisfied with the results? Might they have killed themselves? There is no curiosity, no investigation. So I will mention this with the Maya Hughes in the WPATH files. One of the emails that she and her team exposed between physicians and psychiatrists in one of the World Professional Association of Transgender Health discussions. And I would have to look up and I could get it to you after the podcast, the doctor's specific name, admitted that somewhere around I think it's close to 30%. I think she said 28% of subjects who were put on blockers in their at that Tanner stage 2. So somewhere between, if they were put on puberty blockers between the ages of 8 and 12, by the time they reached their early 30s, 28% of them regretted that they had reduced fertility or could not get pregnant.
Wow.
And what this is getting at is exactly what you have stated so many times earlier. Children, even teenagers, even someone at age 21, has no concept of, oh, I won't be able to have my own babies. So what? I'm miserable now, and this is going to be my quick fix. But by the time you get past age 25 and that brain development is complete, and you move on from age 25 and realize, whoa, I will never be able to have a biological child of my own. I will never be able to breastfeed, if it's a female, I will never be able to breastfeed my own baby if I can even get pregnant. This is an area of medicine where we simply have to tell the truth. It's evil. This is evil. You don't lie to children. You do not sterilize children. We have good treatments for trauma in childhood, good treatments for depression, anxiety in childhood. We have ways to nurture children through and with their autism, right? So, gender ideology is an evil, pernicious, it is a psychologically, physically harmful lie, just on so many levels. And
Absolutely.
it starts with social transition, which in and of itself is evil and harmful.
Absolutely. And essentially the one of the lies that's being told is you're depressed or you're confused and this will fix it.
Right.
Whether it's just a social transition or if you go further into interventions, you're going to be happy after this. You're going
Right.
to feel no longer confused. But that's not true, right? How many kids and turn into adults still have suicidal ideation? It doesn't take away the risk. In fact, it increases the risk of committing suicide or having suicidal ideation. But could you talk a little bit about um, about that psychology, right? That behind it all, that's pushing these children on this conveyor belt, saying this is going to make you happy, or this will make you feel like you actually have a better handle on your identity, your sexual identity.
Sure. So if you start the child off on, and this gets to the conveyor belt analogy that you used earlier. Um, so if we do go forward and lie to the child, it's role playing. The child is role playing. So in the short term, we are helping the little girl appear more like a boy, but you can't ever be a boy if you're a girl. We're helping the boy act like a girl. It's impersonation, and so they might feel or look a little bit happier because we're helping them carry out this fantasy. However, as they approach, come to like age, between those ages of 8 and 12, their bodies are going to start telling them, are going to out them. Their bodies are going to tell the truth because biology 101 is biology 101. And so the transgender ideologues say, oh my gosh, your anxiety is going to peak. Oh, we can't, we have to put the pause button on. We need to put you on puberty blockers and they won't harm you, which of course is another lie on, again, multiple levels. Because to stop normally timed puberty is to rob a child of a critical, normal developmental period of life. Physically, puberty is when the natural sex hormones organize the neurology of the brain, responsible for a process called pruning, and the brain is very rapidly restructured, and growth, uh, exponential growth occurs. So we are damaging their brains. We have definitive evidence that we are also damaging their bones by putting them on puberty blockers. Those children will never attain their correct adult height or bone density. Oh, so what? Well, so what? When they get to be young adults, they are at higher risk for bone fractures and osteoporosis way before their time. And of course, the points that the ideologues focus on is that, well, we will prevent them from developing into the sex they don't want to be. It prolongs the fantasy. It's chemical drag. If you think about cross dressers who perform in drag shows, well, they're cross dressing. They haven't changed anything about their true nature. They haven't changed anything about the fact that they are male. The same thing can be said about putting boys and girls on puberty blockers. This is simply chemical drag. We cannot change their sex. Sooner or later, they are going to have to come to terms with the fact that the puberty blockers have chemically castrated their development chemically at the level of the brain. That is true of boys and girls. And when you put them on those puberty blockers, we have 5 studies. Out of 4 of those studies, 100% of the kids who went on puberty blockers, 100% of those kids went on to cross-sex hormones. A 4th study found 96% of those kids on blockers went on to cross-sex hormones. When you combine the two, we know you will end up sterilizing those children, because if you put a young child on the blockers, their bodies are not able to develop mature ovaries and eggs or mature testes and sperm if they're boys. But the psychology is, if the adults in my world help me role play my fantasy by gaslighting, telling me what I want to hear, so lying, gaslighting me, then physically helping me role play, chemically helping me role play, my sex identity disorder will continue. That's common sense. Every human being knows this just from being alive. If someone helps you role play something, particularly not just in your own home, but society wide, in schools, the workplace, government imposed, etc., you are going to persist in your mistaken belief, and you will continue to be exploited by big pharma, by big medicine, because these drugs and surgeries are extremely profitable.
They're money
Mm,
makers
they are.
for the pharmaceutical industry and the healthcare industry for
Right.
sure. When you were talking earlier about the one boy who around 3, etcetera, obviously there was trauma because of he saw how much attention his parents were giving his sister who had a condition, and so she needed extra attention, but he was seeking that attention. You know, of course, we know was it Jeff Younger's son who
Mm,
was imposed by his mom generally because he only wanted to dress up like a girl for his mom. So there is also that component of it. But when we talk about role playing or make believe, you have kids when they're little who want to be pirates and they want to
yes.
be a mermaid and they want to be whatever they want to be. So can you compare that just the normal exploration, imagination of a child and how even if they're confused just because they're role playing in different ways, even with these other things. I'm a cowboy today, etc. How that's different from or similar to when they have confusion. And do you see that confusion as mainly as the result of trauma or, as you mentioned, some even medical conditions? Or how much of it is that they're just still also learning the world and what role does mom play in my life, or role does dad play if there's a dad in the picture,
Right.
or if there's mom in the picture, right? And how much of the surroundings, the context of the environment in which the child is growing up in is affecting their understanding of what it means to be a male or a female.
Right. I mean, the problem isn't role playing per se. The problem is that it's indoctrination. Right. When it comes to children pretending to be pirates, whether it's girls or boys pretending to be pirates, cowboys, animals, whatever, it's fine if the adults in the room, the adults in their lives reinforce, "Oh, yeah, isn't it fun to play like this?" And but it ends, right? Okay, oh, it's in preschool, or it's mom and dad and or son, daughter, just having playtime, and particularly between the ages of 2 and 7, magical thinking, imaginative play, very active in those years. Um, and you want to keep encouraging that imagination, but not to the point of blurring reality. Prior to transgender ideology being imposed from the top down, um, there was nothing dangerous about a boy dressing up as a princess because, oh, yay, we just saw Wizard of Oz, and I want to dress up like Glinda, or I want to dress whatever. If the family and society maintains a sharp line between imagination and reality, well, that's no problem. And that gets passed on to the child. But this is not at all what is happening with transgender ideology. And once transgender ideology became imposed from the top down, government, schools, libraries, social media, everywhere, you eat, sleep, drink. Our children are eating, sleeping, drinking transgender ideology. I would never say be harsh to a child for cross sex playing or cross dressing, um, in that young age group. I would say, as parents and teachers, we have to make sure they understand, oh, this is playtime. You know what, you are a boy who XYZ. make sure they know, oh, you know what, you are artistic, you are caring, you have a great imagination. Make sure that they understand, oh, sure, you are a boy who likes these things. You are a boy with these admirable traits. And the same would go for girls. Oh, you love to climb trees and play in the mud or whatever. You are a girl who loves these things, who has these great traits. We need to work harder as parents and mentors to make sure our children know the difference between sex, which is it's their physical bodies and they're a core part of their identity. The difference between sex and sex stereotypes, the difference between sex and personality traits. Whereas in the past, we didn't have to worry about that.
Right. I mean, in the past, if you were a girl who climbed trees and liked to get play in the dirt, etc., you were
Yeah,
considered a tomboy.
right.
You weren't pushed to transition that as
No,
if you were supposed to be a boy, that you were
right,
quote unquote born in the wrong body. The same with a boy who may enjoy helping mom in the kitchen with cooking. Just because a boy has an interest in that doesn't make him a girl.
right. No, right,
Right. And so these are the things where today, especially if there are children who are in families or who are pushing for the ideology, it seems like it turns out more the case because when a child just naturally gravitates towards something and then the family or the parents or someone in that child's life imposes on that child, oh, maybe you're in the wrong body. And
right.
and and that is so, so harmful. What is the rationale given by advocates who push for socially transitioning children?
The advocates maintain that it actually arose from adult transgender rights. The adult transgender rights movement, most adults who identify as transgender are not healthy. They're not physically or mentally healthy and they are very unhappy. And those adults in the trans civil rights movement argued without evidence, well, I was born this way. And if I had been able to transition as a child, I'd be happy now. That is literally where the myth of the transgender child was born. It was born in the minds of suffering trans identified adults and the clinicians who would benefit financially or otherwise from this industry. So, no child is born in the wrong body. No child's born in the wrong body. And if we really and truly want to be compassionate, it starts by rejecting the false ideology. It starts by embracing all children and helping them recognize their bodies are beautiful just as they were born and helping them, nurturing them uh, in their talents, virtue, and ethics.
And really, that stereotypes about what a male or female do shouldn't play into this because obviously we're born with different interests. So if there's
Right,
specific hobbies or there's more of a creative or streak or whatever that might be, we shouldn't be so quick to stereotype that child because obviously there's so much diversity, right?
right.
We can have different interests, and I think that needs to that's part of the discussion because if
Yes,
what's crazy is that it's the ideologues who push for the transgender um interventions that are actually not seeing outside the box of the sex stereotypes. Oh, you like these
correct.
things. You like to dress in dresses. That means you must be a girl, even though you're
Yeah,
biologically a boy.
yes,
And so we have to get away from that.
yes,
Obviously, there are things that are associated with a particular sex more than the other, but that's where we have diversity of expression. I wanted to now talk a little bit about what are the risks of the social transitioning. We already talked a little bit about this, but what do you see as the main risks? If you had to summarize those risks for our audience, both I would say the physical and the mental risks that social transitioning brings.
I think the largest risks are mentally and psychologically, because again, from at whichever stage, we aid, we are aiding a child in living out a lie. That's, I mean, the younger the child when we lie about their bodies, the worse it is. Again, a child prior to the age of 7 simply does not have the cognitive or psychological capacity to understand sex is a physical trait that does not change. Boys grow into men and will always be men, regardless of their external appearance. Girls grow into women and will always be female, regardless of their external appearance. That is not understood by the very young child. And anywhere along the way, even during adolescence, and I would even say and many others, even, for example, Aaron Friday, attorney Aaron Friday, the founder of Our Duty, even young adults, they are still very vulnerable at the college age, very vulnerable to misinformation, love bombing, particularly if they have autism, even just developmentally at that college stage, very vulnerable to this gender ideology and lies. And when you socially transition at any of those ages, we are helping them live out a lie. So it is abuse of those individuals, the children and the young adults. It is psychological abuse. It is gaslighting. So it's wrong in and of itself. It's also physically harmful because it's a conveyor belt to the chemical and surgical um, sex rejecting procedures. A teenager who goes through puberty prior to medical transition has the possibility of preserving, a stronger possibility of preserving their fertility, but you are still going to be, because of the gaslighting, that social transition, which is gaslighting, because of that, if they go on to the cross sex hormones, they are elevating their risks for various cancers, strokes, heart attacks, even diabetes, and emotional and mental issues as well. And these are pernicious lies.
And really, I think that for our audience
Mm.
here, I wanted to also go into the long term effects of the social transition. For example, if that child grows into an adult and never does any of those puberty blockers or cross sex hormones or surgical interventions, but continues to persist in a new identity and has just socially transitioned, what effect does that have on the mind when you continue to live this lie, as you're saying, for years on end? Do we have any research about the psychological effects of just social transitioning?
I do not know of large numbers of, uh, let's say, narrative observational study. I know of individual case reports. And so, based on case reports, it is very difficult to walk back. If you have presented as the opposite sex for as a child a number of months or years, can you imagine if let's say from uh, third grade through middle school age 11, what if just third grade through, let's say, age 11, you've presented in one as one sex, and then your let's say family was able to change their mind about supporting, and were able to say, well, we don't want to go on with puberty blockers now. I mean, short of moving maybe out of state and going to a an entirely new community, and that's almost what it would take to reintroduce the child as their actual sex. I will say, the American Psychological Association has a handbook of psychology and sexuality that was published in 2014. Within the chapter on gender dysphoria, and it does note that social transition is not easy to reverse. It is not easy to reverse because of as I said, unless you could literally move out of state and just start over as the proper I don't know how it would be so difficult to come out with, well, actually, I'm not a boy, I'm really a girl. I'm not a girl, I'm really a boy.
And this is why social transition is so harmful. And you were talking about the love bombing. When you have a community, whether it's the GSA, et cetera, that's you know, encouraging you to transition. If you were to pull back and you're not getting that love or acceptance anymore from exactly that community that you sought it to begin with. And so it puts children, especially because they're vulnerable, whether it's because of past trauma or because of a medical condition, it puts them in a very vulnerable position because they're wanting to be accepted, and it's very hard to reverse course, as you said, to a different location with their family. Now, some studies claim that transition reduces depression and suicide risk. We touched on this a little bit earlier. Is that true?
So the short answer is no, that's not true. There may be a honeymoon period, which I don't think I've used that term, but the honeymoon period with social transition, just as there's this honeymoon period with the drug or surgical interventions, because we're in the short term helping the child carry out their fantasy. So there's this, okay, I don't have to confront reality. Not that they're thinking this, but psychologically there's this breather. Okay, I can continue this fantasy, so I'm happy in the short term. But Dr. Christina Olson, child psychologist, is one who has done significant publication in this area, alleging that parents who socially transition their children, that those children do well, but in fact, what further studies have revealed, and I'm thinking in particular, Dr. Walter Shum, after reviewing Christina Olson's work, contacted her and asked her if she would share her entire data set with him. And she agreed to. She shared the entire data set. And he was able to reanalyze the data set, identified that she had ignored certain groups as well as made statistical errors. When he corrected those statistical errors and actually included the entire data set, some of which she had excluded, the conclusion was the opposite. He found that the young people who were socially transitioned actually increased in anxiety and decreased in self-worth the longer they were socially transitioned. In addition, there was a study, a large study that was in 2020 that he published his work in the Linacre Quarterly. I believe there was a 2024 study out of Germany, which demonstrated it was not the social transitioning, it was the nurturing of parents and peers. So if a child who believed they were trapped in the wrong body, it was the family and peer support they had, not necessarily whether they socially transitioned or not. It was that external support that mattered the most. So that's what we're looking at is
Wow.
the studies, studies alleging that social transition is a good thing are essentially they are flawed. And what we really want to do is what we were talking about earlier, helping children love the bodies they're in with the personalities they have.
Right.
Yeah.
And speaking of that, so we talked a little bit about how hormones and surgery are the likely steps after the social transition. Can you speak a little bit into how much more likely is it that a child who starts the social transition process ends up going down that road versus if that never happens? I mean, are there even cases where a child just goes from being their biological sex, their actual sex, to then going into chemical or surgical interventions? It seems like it's the in between step that they first start turning. So obviously the social transition is a huge component.
Absolutely. Yes. Prior to 2013, when we had the Diagnostic and Statistical Manual 4 and and then they had a revised fourth edition, it was a requirement. Social transition for 6 months was a requirement before any medical or any drug or surgical intervention. And that was a requirement for adults. And it just generally was not recommended for children at all. The first gender clinic in the US opened in 2007. I'm sorry, the first pediatric gender clinic opened at Boston Children's in 2007. It really was not until uh, beyond 2013. 2013, we had the publication of the DSM-5, Diagnostic Statistical Manual 5, 5th edition by the American Psychiatric Association. And it was following the change in the terminology from gender identity disorder to gender dysphoria. That's sort of when I think the gender ideologues in medicine and psychology felt more empowered to push active social transition and the medical pathway.
Right. And we were also talking about how the normal child development that takes place once you do the social transition, what effects does that have on their identity long term? And we mentioned that if it persists into adulthood, and unless they move or change communities, it's hard to go back. But especially on a child who is obviously developing his or her personality, doing the social transition, even for a short time or obviously over a long period of time, what kind of effects does that have on the psyche?
So I would say social transition alone is going to have the fewest long-term side effects. It's very difficult. The longer a child role plays as the opposite sex, the more, I would say, the more short-term anxiety and social difficulty they will have to reestablish themselves in their actual identity. But I don't think it is something they are going to have to eh, struggle with their entire life, particularly if they have parents or adult mentors who can nurture them along the way. It's going to be rocky, but it can, it can be overcome. I do know two cases personally in which they were two teenage girls who socially transitioned in early high school, whose parents were fortunate enough to find resources in their area such that they could convince their daughters that, we are going to explore gender together. And in their cases, the transition, if you will, the social acting out with the different names at school, the different pronouns. The families did not use different pronouns or names in the home, but those two cases, uh, the girls were able to come to terms with their actual physical sex and true identity by the end of high school. And going forward into college, it wasn't an issue. So they had a new starting point and we're back to their true name, their true pronouns. So they were spared, they were saved from blockers and cross-sex hormones and surgeries. So I guess case by case, but generally speaking, there is a lot of hope if we can help families. Of course, prevention help families prevent their children from falling into the gender ideology lies, but also there is still hope to help parents or families if their child is at that social role play stage. There's hope for helping them pull them out. It won't be easy. It's not easy, but it's not life altering the way chemicals and surgeries are.
And it sounds from what you're saying that if they have the support of
Right.
their parents, their families in showing them and continuing to show reality to them. This is your biological male or female, and doing so in a loving way
Mm,
helps them so that they don't become locked into that identity versus what the, JSA, at their school, etcetera, is
right.
pushing, which is to say, "No, this new personality, this new identity you took on, that's
Correct.
your real you," and help them to persist in that. So, that's really good news that even if a child has, uh has thought that he or she is the opposite sex with the right supports, and especially you mentioned earlier, that if they have the therapy to get to the underlying trauma
Correct.
or whatever medical conditions they've had that have led them to, come to this conclusion, that they can actually, come out the other side and embrace who they are biologically.
Absolutely. And Advocates Protecting Children is a small, young nonprofit that really is by parents. I was invited to join the board of directors recently, and they are a nonprofit organized by parents, dedicated to producing resources for parents and families who either, well, first and foremost, who might have one or more children um, captured in this groupthink, this social contagion of transgender identity, um, and also for those families that perhaps want to get a jump on things and protect their children from getting sneered. So that is a good place to for families to start. Biological integrity with the American College of Pediatricians. If you want audience members looking for just the solid science versus gender ideology, I encourage you to go to biologicalintegrity.org. Families looking for resources, I recommend Advocates Protecting Children.
I wanna ask a question about, that is particular for especially for parents who are, in this situation. If a child asks to use a new name or pronoun, how should parents respond in a loving but grounded way?
First, there's no single right answer because in part it's going to depend. The language you use is in part going to depend on your relationship with your child and your child's personality. Generally speaking, the first when this is very hard, but as a parent, the first reaction from us has to be it could be as honest as, oh, whoa, this is okay, this is kind of heavy, but I love you. You have to know I love you. I usually say, parents, tell your child immediately, I love you. Give them a hug. Of course, if you have a child who doesn't, maybe they're not a huggy type, you're not going to do that. But you must very quickly communicate, I love you. And I'm not going to leave you alone. You're not going to go through this alone. We will go through this together. Um, this is, I'm so sorry. This is kind of heavy for me. I hope can you understand how this might be heavy and see what the child says? But somehow you've got to communicate immediately. I love you.
Mm.
You're not going to go through this alone. And you don't think, I mean, as parents, and I'm speaking as, yeah, I'm a pediatrician, but as a mother, our knee jerk is, we can fix this. We got to fix this. We got to solve this. No. Oh my gosh. No, we have to really take a deep breath and a step back. Love first. And we're going to go through this together. You might have to try and slow things down a little. What has worked for some families is not necessarily right in that very first moment, but some families, some parents are able to have their child is able to understand, okay, we love you unconditionally. Can you understand that we are concerned? We want you to be the healthiest you can be. We gave you, we gave you your name. That's was our first gift. Well, second gift, right? It's the gift of life first. But the name we gave you was a gift from us to you. Okay, we understand you don't want this right now. Can you understand how calling you X would really hurt or trouble us? Can we compromise? Can we compromise? Can we call you a truthful nickname? Like, I had one family, for example, that the child and parent agreed on the name Precious. You are our precious child. And I think this was a girl who wanted to be a boy. And they were able to agree that the parents were going to avoid pronouns, but they agreed on a nickname that reflected the love the parents had for the child. So it was neither an opposite sex name nor the given name, and it brought the family and the child. It maintained the relationship to the point that they were able to walk together. Um, and make progress that way.
And really what you're saying is that the walking together is the most important part. That the
Yes.
child knows, "We love you. We
Mhm.
love you, and we're going to walk with you every step of the way."
Right.
And that we're not going to abandon you. And I think that's so important for children to hear, especially in light of the fact that some schools are keeping parents in the dark and sidelining them. So what rights do parents have to protect their kids from social transition when it comes to school settings?
Regardless of where you live, you parents need to assume they have no rights, despite the fact that the Trump administration gave guidance to. So under Obama back in 2014, the Obama administration in 2014 essentially put all public schools on notice that they were at risk of losing federal dollars unless they treated gender identity the same as sex under Title 19. So public schools already, if a child goes to a teacher or a guidance counselor, school psychologist, any school staff for issues regarding sex, drugs, alcohol, mental health, the school is not required to notify parents. So the moment the Obama administration said, hey, you could lose money unless you treat gender identity in the same category as sex. So risk of pregnancy, risk of sexually transmitted diseases, now gender identity is put in that same category. Schools, and it comes to money, that's where virtually every public school in America bowed down to the mighty dollar and said, oh, okay, we don't want to forfeit any federal dollars. Right. Gender identity. A child comes with gender confusion. We can't talk to parents unless the child says it's okay. Just as if a child went to school staff and said, you know what, I'm uh, with issues of drugs or alcohol, or I might have a sexually transmitted disease. Schools are not required to inform parents unless the child says they're okay with it. So parents, high alert. This is why many parent activists and child advocates have said it's time to pull kids out of public schools altogether, and even private schools. They are. You cannot assume that private schools or even religious schools are protected against this transgender ideology. Homeschooling has really taken off, particularly after the COVID lockdowns, because that's when many parents first became aware of what their children were being taught and not taught. So Yeah.
That's mindful.
Assume it is mind blowing, but honest to goodness, it is that bad. Our education system truly is that bad, regardless of, don't think I'm in a red state, I'm safe. No, no, do not assume that at all. Not at all. It's buyer beware.
It's mind blowing that parents who make the decisions for their children until they're adults generally, a child can't go into a store and buy alcohol or cigarettes, and yet a child can go to school and have access to abortion or interventions for sexual identity disorder without their parents knowing. That's
Correct.
mind blowing. So, what can be done federally or even at the state level to start reversing course on that in the public schools? Is especially in the public schools because they're so dependent on federal dollars. There should be something that can be done to reverse course and actually give parents the rights back to make decisions for their kids, apart from pulling them out of the school altogether. What about the rest of the majority of the kids who are still in public school?
So from a financial point of from a fiscal, let me put it this way, from a fiscal point of view, and I'm not the only one to say this, the most effective thing parents can do to force a change in the public education is to pull the children out of the system, because it may even be more money now, but each child pulled out is basically causing the public schools to lose $10,000, probably even higher than that now. It is simply so severe. It's not just the attack on parent rights. It's not just the transgender ideology. It's a complete failure to teach reading, writing, and arithmetic. And it's not just gender indoctrination. It's DEI, Marxist, everything being put through a Marxist lens. I mean, parents who would like to do a deeper dive, I do recommend you can Google Alex Newman, who is a proponent not only of, but I would say a proponent of school choice, and he has just dedicated decades of his life to documenting sort of the various ideologies that are driving public education and why uh, our students' scores for just reading and reading, writing, arithmetic are steadily trending downward. Some may object because they will accuse him of being, on the far right. But you know what? Don't limit yourself to him. Do a deep
Right.
dive. Do a deep dive and make the best choice for yourself. You come to the conclusion that you cannot pull your children out, then by all means, just realize you need to have conversations with each of your children's teachers. Find out, you have a right to request the curriculum to see what's being taught in each and every class. You have the right to sit down with each and every teacher and ask them questions. You have the right to then go, start with the basics, what's in the classroom, because teachers can also bring in their own books for their students' pleasure reading. You have to find out what's in the library, so you can go and interview the librarian. You can go interview the principal, but it is hard work, very hard work.
And it sounds that we need education reform in
Yes,
general, just on this
yes,
issue, but on everything. The fact that children aren't really learning what they ought to be learning by their grade level when it comes to math and science and
right,
history, geography, the rest of those things that you
yes.
actually send your kids to school to learn, not to learn DEI and this ideology and to encourage that. But what about teachers or individual teachers or staff at school who don't wanna go along with that? Do they have any rights? Because obviously the school will be pushing for that if a child says, "Oh, I wanna be called by this name, or I wanna use the opposite sex bathroom," etcetera. You're saying, well, the schools already have, capitulated, because of their own financial interests. But what about individuals in the school?
There's always a certain amount of self-selection that happens too. So unfortunately, the two largest teacher unions, the National Education Association and the American Teachers Federation, they have been far left for decades, and they are entirely on board with the transgender agenda. And as a result, teachers who want to remain committed to Biology 101, regardless of what side of the aisle the individual teacher is on, they are persecuted. They're persecuted. They will be censored, they will be demoted or outright fired. Now, many of those teachers, I know a couple at the college level have filed suit, and I believe, also at the high school level have filed suit against either their school districts or particular university for being fired for refusing to use student preferred pronouns, for example. But essentially, there are individual teachers who have been trying to fight back. I think they're few and far between, again, because it is a huge uphill battle.
And are parents getting the full story, or is the information that's given to them one-sided, would you say, about the sexual identity disorder and how it affects their children?
Right. No, parents are being lied to, despite having a federal administration or presidential administration, which is trying to at least get the facts in place. Thank goodness. It is there, and we're just at the very beginnings, just at the very beginnings of having the facts restored to departments of Health and Human Services, the Education Department, which at the same time the Trump administration is trying to downsize. It's sort of like trying to build the plane while we're flying. It's tough. So from a parent perspective or a family perspective, it really does fall all on your shoulders. And at the very local level, always try working at the local grassroots level first. Assess your situation locally, but just know from the macro point of view, even if you identify individuals who are dedicated to Biology 101, from the macro point of view, it's not favorable to parents, and it's not favorable to those individual teachers or an individual principal. So you're going to have to, you really have to start anchoring your local individual teachers, principals, and school systems. If you can, at the school committee level, you might be able to try to start working to build on a foundation of basic truth, basic Bio 101, but you will be opposed by the big groups. For example, you will have, and I've seen this firsthand in a town in which parents were able to elect school committee members um, who are completely on board with Bio 101 because these school committee members have children in the system. Most of them have daughters in the system, and so they want to honor uh, biological truth. And they're also they're it's a blue state. It's a blue state, and it's a small town, one of the smallest towns in this blue state. But anytime the issue of sport, any kind of issue that could relate to the sexes arises, those school committee meetings rather, are flooded by trans activists, not only from that blue state, but from out of state. They import. So this is such a well-funded top-down imposition. It's a top-down tyranny, ideological tyranny. So I don't want to discourage people from fighting. I do want to encourage you to take a good hard look at the homeschool option. All of you from across the political aisle. This is not just a Christian thing. Homeschooling is not just a Christian thing. It is not just a conservative thing. It truly is about parents nurturing their children the best way possible. And it's not a bunch of like independent little families educating their kids. The co-ops form. It's truly a grassroots way of educating, and it can be phenomenal. It's much more diverse than it ever was.
And it's about reclaiming, parental rights. Parents are the first educators of their
Yeah,
children. At least should be. That is their role, and that is one way to reclaim that right. We're coming up on the last couple of questions, Dr. Cretella. You mentioned that if a child, if parents find out that their child is struggling with sexual identity disorder, obviously the first thing to do is to tell them that you love them and that you will walk with them. What other healthier alternatives, in addition to those things, can families turn to that show compassion without rushing them into transition? What are some other steps that they can do as they're walking along with their child to help them along the way?
right. So um basically, my recommendation is two excellent resources. Number one, Advocates Protecting Children. There is a book that I think is excellent for parents, outstanding. It is called by Maria Keffler, Desist, Detrans, Detox. And this is an excellent backgrounder to gender ideology, and it frames it as the social cult that it is, and it walks families through how to deprogram your child. Uh, and so that's an excellent step-by-step guide. Now, in addition, at the same time, I also would recommend families visit therapyfirst.org. Therapyfirst.org is an online organization of therapists, psychologists, and other mental health clinicians dedicated to the truth that no child's born in the wrong body. And they have excellent resources for parents, families, and even physicians and therapists in how you can help children of very, well, especially adolescents, how you can especially help adolescents explore what this new identity means for them. Why did they jump to this new identity? What does it mean for them? And are there other ways to get the benefits that the children are looking for? And they also have a therapist network that families can tap into. I would say, because there is no one answer for every family in this gender lie. Those are the probably the two best resources. So Advocates Protecting Children and therapyfirst.org.
And we will link to those as well. And lastly, if you were going to speak exactly directly to a child who is right now struggling with sexual identity confusion, what do you want them to know about their struggle and about what they're going through?
I would want them to know they are not alone. They are not alone. I think the most important thing to recognize is that young people who claim or appear to be happy and have it all together, even those people, especially on, Instagram or uh, your favorite social media platform, it's a facade. It's
Mhm.
not. It's not real. It's not real. Everyone, everyone has periods of pain, periods of questioning, periods where they're just in despair and they think there's no way out. Please, please explore. Explore the possibility that you do not have to harm your body.
Mm. That's so beautifully said, Dr. Cretella, and it's a message that we will certainly get out there.
Mm,
And really, what came to my mind during our whole conversation is that this gender ideology is like the story of the emperor has no clothes, right?
Yeah.
That there's a lie, there's a pervasive lie that's being sold to the public, to our kids. We are the ones saying the emperor has no clothes. This is not the solution. You're actually harming children. And thank you for being such a clear voice on this and sharing truth, biological reality, and true compassion to those who are struggling with gender identity disorder and sexual confusion. So thank you so much, Dr.
Oh,
Cretella.
thank you so much for being brave enough to tackle this contentious topic, and thank you for having me on.
Thanks so much for listening to this episode of the Bioethics Babe podcast. If you've enjoyed this content, please subscribe to my YouTube channel and your favorite podcast platform, and share with your friends and family. Also check out bioethicsbabe.com for the latest episodes and resources.